When I first started at SGS, I was a bit surprised about how big the data management department is. There's 300 colleagues, but it doesn't really feel like that much because we have a very good team spirit and a very nice cross-functional vibe as well, because we are lucky enough to have a lot of in-house departments. And because we have a general knowledge about each other's processes, it's also easier to align with each other. Our communication is also very clear and smooth. In my experience as a clinical data manager at SGS, you're kind of like a jack of all trades because you're not just focused on one specific task, but instead you're responsible for many different processes within different phases of a clinical trial. And in my opinion, this is very valuable because not only do you get a better overview of how a clinical trial works and looks like, but also gets you to learn more about the processes and extend your own skill set. For example, when a trial starts, during trial setup, we are involved in the front-end specification review. So we already get a good view of the scope of a trial and the data that will be involved, which is important for the conduct part, in which we perform the data cleaning activities and coding activities on SDTM data. When I first started out at SGS, my initial study task was to perform data cleaning on the SDTM datasets. And in my opinion, this is perfect to start out because you immediately get immersed within the SDTM language and you get to understand more about the data that is involved, especially when you're more experienced and when you encounter clients that are not that acquainted with SDTM. It is easy to also provide them with guidance and knowledge